A very good evening to all our audience Today at Avrox Healthcare, we have brought to you a very important topic of blood pressure. Tension nahi lene ka, dene ka. It is a very common thing that we hear across all the ages and across all the socioeconomic strata, across all the castes, religions, genders. So it has become a fairly common problem. And for this, discussing this, we have a renowned cardiologist amongst us, who is Dr. Hitendra Bhagwatkar. He is a consultant interventional cardiologist and assistant professor at NKP Salve Institute of Medical Sciences and Lata Mangeshkar Hospital, Nagpur. He has a total experience of 8 years, and he has done more than 1,000 angioplasties, more than 5,000 angiographies, various publications in European and American heart journals. He's also a fellow member in European Society of Cardiology and former consultant cardiologist at Avanti Hospital, Care Hospital, Hyderabad. So please welcome Dr. Hitendra Bhagwatkar on our show tonight.
Hello, good evening. Thank you, Dr. Surabhi, for a very nice introduction. जैसे we have discussed today topic that is the most important topic I feel in medicine, that is hypertension. इसको हम लोग blood pressure भी बोलते हैं. Blood pressure एक बहुत common बीमारी है, disease है, जो हमारी society में it is very much prevalent. As you can see that blood pressure among 5 people, 2 to 3 people can have blood pressure, and most of them are very negligent regarding that. They don't care they have blood pressures, and there are a lot of myths regarding this.
Right. So just
So,
to start with the company's introduction briefly, Avrox Healthcare is a digital healthcare company, and on this we actually bring such important shows for public awareness. And as we would like to start with the brief introduction of the topic, so I think Dr. Hitendra Bhagwatkar would be the best person to ask. So I think we should just continue even with the brief introduction of the topic with you.
yes. So, I have made a small presentation so that a very graphical, diagrammatic presentation. So most of the viewers who are
Public
on
will
Facebook and
understand.
YouTube, so they can see and they can easily understand it. Dr. Surbi, can you see it?
Yes, I can see it.
Yeah. So we can see like 50 million are estimated to have hypertension, and 1 in 4 have very high blood pressure, and 1 in 3 don't realize it. उनको रियलाइजेशन ही नहीं है कि हमको ब्लड प्रेशर है, और बहुत टाइम हम लोग को तब पता चलता है कि इनको ब्लड प्रेशर है व्हेन दे आर लैंडेड इन सम कॉम्प्लिकेशंस, जैसे हार्ट अटैक या ब्रेन का स्ट्रोक. और हाइपरटेंशन इज द मोस्ट कॉमन कॉज ऑफ डेथ अक्रॉस द वर्ल्ड. इंडिया में इसका
Wow.
इंसिडेंस है 6 से 14%. सो वी हैव अ वेरी हाई इंसिडेंस ऑफ ब्लड प्रेशर, और हर साल इट गोज ऑन इंक्रीजिंग. सो देर आर कॉमन मिथ्स, जैसे हार्ट क्या है, लाइक व्हाट हाउ डज द हार्ट वर्क्स एंड हाउ इम्पोर्टेंट द हार्ट इज. ये हार्ट इज वेरी मच इम्पोर्टेंट बिकॉज हमारे बॉडी में वो एक इंजन है, जैसे एक मोटर रहती है जो बॉडी में हर जगह पे ब्लड सर्कुलेट करता है. और ये जब सर्कुलेशन का प्रेशर बढ़ जाता है तो उस टाइम पे हमें होता है हाइपरटेंशन, जिसको हम लोग बोलते हैं हाई ब्लड प्रेशर. और हाँ, ये हार्ट को भी ब्लड सप्लाई मिलता है थ्रू कोरोनरी आर्टरीज, और जब इनमें जो ब्लॉकेजेस होते हैं तब उसके कारण ही पेशेंट को हार्ट अटैक आता है. और मोस्ट कॉमन और ब्लॉकेजेस होने का कारण है हाइपरटेंशन. सो नॉर्मल वैल्यू कितना रहता है ब्लड प्रेशर का? नॉर्मल वैल्यू इज 120/80. अगर इससे ज्यादा किसी का ब्लड प्रेशर आता है तो उसे हम लोग हाई ब्लड प्रेशर बोलते हैं या हाइपरटेंशन बोलते हैं. इसके अलग अलग स्टेजेस होते हैं, जिसके हिसाब से हम लोग पेशेंट को इनिशियली क्या मेडिसिन स्टार्ट करना है या लाइफस्टाइल मॉडिफिकेशन करना है, हम उस पे स्ट्रेटिफाई करते हैं और उस हिसाब से मेडिसिन स्टार्ट करते हैं. सो should my blood pressure always remain normal? No. Blood pressure, it's a very volatile component. ये बहुत लेबाइल कंपोनेंट होता है. ये बहुत, जैसे एक्सरसाइज करने से स्ट्रेस, एंगर और फियर, your blood pressure will rise. So there are a lot of conditions in which the blood pressure rises. हाई ब्लड प्रेशर कब होता है? एज आई सेड, मोर देन 120/80 अगर ब्लड प्रेशर रहा तो वो, उसको हाई ब्लड प्रेशर बोलते हैं, उसको हाइपरटेंशन बोलते हैं। और जी हाँ, हाई ब्लड प्रेशर हैज इफेक्ट ऑन योर बॉडी स्टार्टिंग फ्रॉम योर हेड टू टो। इट कैन कॉज प्रॉब्लम्स टू योर आईज। ब्रेन में ये स्ट्रोक कर सकता है जिसके कारण लकवा या पैरालिसिस हो सकता है। कमिंग टू योर हार्ट, इट कैन कॉज हार्ट अटैक, हार्ट फेलियर। ये हमारे नसों में इट कैन कॉज ब्लॉकेजेस जिसके कारण हार्ट अटैक आ सकता है। इट कैन ऑल्सो अफेक्ट द किडनी, हमारी किडनी को अफेक्ट हो सकते। इट कैन कॉज एक्यूट किडनी फेलियर जिसके कारण पेशेंट में रिक्वायर्ड डायलिसिस, बाद में जाके उनको डायलिसिस लग सकता है। तो ये है हाई ब्लड प्रेशर के बहुत इंपॉर्टेंट साइड इफेक्ट्स। सो ब्लड प्रेशर रेगुलर चेकअप करना बहुत जरूरी है। सो हम लोग इसे घर पे भी चेक कर सकते हैं, बट इसके चेक करने का एक प्रॉपर तरीका वी शुड नो। द बेस्ट थिंग इज वेन एवर यू हैव एनी प्रॉब्लम्स, go to your family doctor and check the blood pressure. Blood pressure can cause high symptoms. Yes, high blood pressure definitely cause symptoms, but कभी कभी symptoms नहीं भी रह सकते, इसलिए रेगुलर ब्लड प्रेशर चेक करना बहुत इंपॉर्टेंट। ये ब्लड प्रेशर बढ़ने के व्हाट आर द रिस्क फैक्टर्स? फर्स्ट इज एज, सेक्स। जैसे मेल में कॉमनली ज्यादा ब्लड प्रेशर पाया जाता है एज कंपेयर टू फीमेल्स। इफ देयर इज अ वेरी स्ट्रॉन्ग फैमिली हिस्ट्री, आपके मदर फादर को ब्लड प्रेशर है, देन यू कैन ऑल्सो हैव हाई ब्लड प्रेशर। ओबेसिटी, मोटापापन, ये भी बहुत कॉमन फैक्टर है ब्लड प्रेशर होने के। एंड डाइट, हम लोग डाइट में क्या लेते हैं, ऑयली फूड्स, दैट आई विल डिस्कस लेटर कि कौन से फूड से हम लोग को हाई ब्लड प्रेशर हो सकता है। एंड लैक ऑफ एक्सरसाइज, अगर हम लोग एक्सरसाइज नहीं करते हैं, मैक्सिमम टाइम वी आर सिटिंग द लैपटॉप, जैसे वर्क फ्रॉम होम चल रहा है ये वो, तो दिस इज कैन कॉज हाई ब्लड प्रेशर। अदर थिंग्स इज स्ट्रेस, स्मोकिंग, अल्कोहल। कभी भी यू शुड नेवर एवर इग्नोर ब्लड प्रेशर। वेन एवर यू डिटेक्टेड टू हैव ब्लड प्रेशर, आपको ब्लड प्रेशर डिटेक्ट होता है, you should visit your doctors and you should start the medications. Yes, blood pressure is curable, it is manageable, and you can lead a very normal life, so you should not be afraid. अगर आपका high blood pressure हो तो घबराने की कोई जरूरत नहीं है, it is very much treatable. The best fund of life is stay healthy today and forever till you die. Medications, you should never adjust your medications. बहुत सारे पेशेंट्स ऐसे रहते हैं, मेडिसिन डॉक्टर साहब ने चालू कर दिया, मेरा तो ब्लड प्रेशर कंट्रोल हो गया, आई विल स्टॉप द मेडिकेशंस। नो, नेवर एवर। यू शुड नॉट take the judgment, take the decision of stopping your medications or change the dose of medication. You should always consult your family doctor for the change of medications. Dosages right होना बहुत जरूरी है। As मैंने बताया कि hypertension can cause chest pain, सीने में दर्द होना, हार्ट अटैक और हार्ट का साइज बढ़ना जिसके कारण हार्ट फेल हो सकता है, आपको सांस फूल सकती है, यू कैन हैव शॉर्टनेस ऑफ ब्रेथ, यू कैन लैंड अप इनटू हॉस्पिटल फॉर एडमिशन। So these are the common facts about high blood pressure, which should we should keep in mind. जैसे हार्ट अटैक आता है, हार्ट अटैक कब आता है? जब वहां पे ब्लॉकेजेस होते हैं हार्ट में। सो यू कैन सी दिस मैन इज हैविंग अ हार्ट अटैक एंड ही इज कीपिंग हिज हैंड ऑन द चेस्ट, जिसके कारण ही इज ट्राइंग टू इंडिकेट कि हाँ उसको सीने में दर्द हो रहा है, तो ही इज हैविंग अ हार्ट अटैक। और मोस्ट ऑफ द टाइम इट इज बिकॉज ऑफ डिपोजिशन ऑफ कोलेस्ट्रॉल। जो हमारे कोलेस्ट्रॉल चर्बी होती है वो नसों में डिपॉजिट होके इट कॉजेज हार्ट अटैक। इसमें बहुत कॉमन फैक्टर है आपका हाइपरटेंशन। सो कौन सी चीजें हैं जो हम लोग मॉडिफाई कर सकते हैं और कौन सी चीजें नहीं मॉडिफाई कर सकते एक ब्लड प्रेशर में? तो मॉडिफाइड चीजें क्या होती है कि हम लोग स्मोकिंग बंद कर सकते हैं, शुगर कंट्रोल, ओबेसिटी कंट्रोल, फिजिकल एक्टिविटीज कर सकते हैं, वी कैन कंट्रोल अल्कोहल, स्ट्रेस कंट्रोल करते हैं, ये हम लोग कंट्रोल कर सकते हैं। और नॉन मॉडिफाइबल क्या होता है कि अगर अवर एज इज मोर, सो वी आर गेट एज रिलेटेड हाइपरटेंशन, अवर फैमिली हिस्ट्री इज पॉजिटिव, सो वी गेट जेनेटिकली दैट हाइपरटेंशन, तो वो चीजें हम लोग कंट्रोल नहीं कर सकते। इन दैट कंडीशन वी हैव टू स्टार्ट टेकिंग मेडिकेशंस। इसमें ये डायग्रामेटिक, ये हमारी नसें एज यू कैन सी, एंड यहाँ पे नीचे कोलेस्ट्रॉल डिपॉजिट हो रहा है, और इसका मोस्ट कॉमन कॉज है ब्लड प्रेशर, दैट इज हाई ब्लड प्रेशर। हार्ट फेल्योर क्या होता है? जब हार्ट का प्रेशर बहुत ज्यादा बढ़ जाता है, द हार्ट इज नॉट एबल टू कॉन्ट्रैक्ट, और उसके बाद क्या होता है कि उसका साइज बढ़ जाता है एंड इट इज नॉट एबल टू सप्लाई द ब्लड टू द बॉडी। उस टाइम पे अपना हार्ट फेल हो जाता है, जिसके कारण पेशेंट को सांस फूल सकती है एंड ही need to get admit in the hospital. So you can see there is a lot of uh, what we can do to manage our blood pressure is, सबसे पहले we should measure our BP routinely, frequently monitor करना चाहिए. We should take a doctor's advice, take the medications regularly. अच्छा खाना, अच्छा खाना बहुत इंपॉर्टेंट है. इसके लिए मैं बोल रहा था कि देयर इज अ डैश डाइट, DASH. If you go to the Google, you just type it DASH, that is dash diet. So what is dash diet? Dash diet में there is recommendation कि you should have fresh vegetables, you should have fresh fruits, you should avoid salt, कम से कम salt लेना चाहिए आपको. Then you should avoid dairy products, you should avoid and the amount of food जो इंटरवल में रहते हैं उसमें काफी रेस्ट्रिक्शंस रहते हैं, उसको हम लोग डैश डाइट बोलते हैं. एंड जो भी ऑयली फूड्स है और जो भी फास्ट फूड होता है, आजकल फास्ट फूड का काफी ट्रेंड है. इट कंटेन्स अ लॉट अमाउंट ऑफ ऑयल, अ लॉट अमाउंट ऑफ सॉल्ट, जिसके कारण हमारा ब्लड प्रेशर बहुत जल्दी बढ़ जाता है. सो दैट्स व्हाई you should avoid outside food, eat homemade food or fresh food is very much important to maintain a normal blood pressure. कौन से we should eat cereals, wheat, rice, ragi, maize, green leafy vegetables, fruit, fresh fruit and fish, and chocolates, which are sweeteners, ice cream, cakes, pickles, salad, sauces, cheese, ghee, butter, dried food, red meat. इनमें इनका कंजम्पशन हमें कम करना चाहिए. सॉल्ट जैसे मैंने बताया, जितना आप कम सॉल्ट खाओगे उतना ही आपको हार्ट प्रॉब्लम्स और ब्रेन में स्ट्रोक होने के चांसेस कम हो जाते हैं. एक्सरसाइज, इट शुड बिकम अ डेली पार्ट ऑफ योर लाइफ. And likewise you should reduce your blood pressure, exercise, and it causes reduction of your weight, stress भी कम कर जाता है, and also complication like heart attack and stroke भी कम हो जाता है. So you should never stress and should not increase your complications. Meditation is very important. You should relax, and you should do some activities that can relax your mind. Positive thinking is very important, जिसके बारे में सुबी मैम आपको बताएंगे. She will highlight you how to be positive in life and how to meditate. It's most important thing in life. Relaxation is a lot of thing. हम लोग relax हो सकते हैं, enjoy music, do gardening, read books. A lot of things which we can do. Yeah, smoking. Smoking is a nowadays it's a fad. Many of them they smoke, but I'm telling you, smoking का कोई फायदा नहीं. Smoking has lot of complications to your body. It can cause high blood pressure, ये आपको heart attack कर सकता है, kidney problem, brain stroke, paralysis वगैरह, lot of problems. There is no such benefits of smoking. Likewise, you should not smoke even a single cigarette, because cigarette जैसे आप बढ़ते हैं, your addiction increases, and likewise the complication also increases. सेम अल्कोहल कंजम्पशन भी कम करना चाहिए, बिकॉज अल्कोहल ऑल्सो डिक्रीजेस योर ब्रेन एक्टिविटी, आपके लिवर पे असर करता है. हाई कंजम्पशन ऑफ अल्कोहल, एक बहुत अच्छा टर्म है विच इज हम कॉल हॉलीडे हार्ट सिंड्रोम. हॉलीडे हार्ट सिंड्रोम, ये सिंड्रोम पाया गया था मैक्सिमम मेल्स में. यूजुअली जो सैटरडे नाइट, टुडे इज सैटरडे, सो आई लाइक टू दिस सैटरडे नाइट को व्हेन द पीपल यूज्ड टू कंज्यूम अ वेरी हाई अमाउंट ऑफ अल्कोहल, शराब पीने के बाद उनके हार्ट काफी बढ़ जाते थे एंड दे लैंड अप इनटू हार्ट फेलियर, और हार्ट की धड़कन बढ़ जाती थी. उसको हॉलीडे हार्ट सिंड्रोम. इट इज बिकॉज ऑफ हाई अल्कोहल कंजम्पशन. आप यू शुड रिड्यूस योर बॉडी वेट by exercising and taking proper diet, and reduction of weight can be followed by taking
Dr.
regular.
Hitendra,
Yes.
sorry to interrupt. Could you just make it full screen, please?
Yeah, yeah.
Yeah.
Can you see it now? Yeah.
Yes, yes.
Yeah. So, likewise, what are the takeaway message? कि blood pressure ये एक silent killer है. There are a lot of risk factors which I have described. So blood pressure affects your heart. That's why you should always take proper dietary advice, proper exercise, proper medications, proper doctor's advice, proper आपका doctor checkup should be followed to control your hypertension, and you should live a very normal and healthy life. Thank you.
Sorry, I was muted. Yeah, so thank you for that presentation, Dr. Hitendra. It was very informative. I don't think I would be having much questions from to ask you after that presentation. But yeah, definitely, I think there are certain queries that people have. Just say you told us the okay, so we got a question. Are there genetic factors, any specific genes that affect hypertension or any other ischemic heart diseases?
Yes, there are certain genetic factors, specific genes, as you can, if your parents have hypertension, sugar, or if so likely that you can also have hypertension, and you can also can get diabetes in the future. Likewise, heart attack also have certain genes that causes high cholesterol in the body, that can cause deposition and that can cause heart problem. So there are chances of these genes expressing in the children. तो भी उनके parents से वो children में जा सकते हैं genes, and they can have the same problem, and they can have ischemic heart disease, which is called as heart problem. They can also develop that.
The audio is getting disturbed in between, actually.
Audio, okay, sorry.
Yeah, now
Uh,
now it's clear.
so
Okay, so we
yeah,
have another question from Priyanka Datta. Hi, I'm diagnosed with high risk lipid profile and high BP 140 by 90 also. I'm on medications for cholesterol, but for BP, doc suggests me to sleep properly, no salt diet, avoid tension, and didn't start medication yet. So please guide me.
see, if you are getting high cholesterol, you have already started
The
medication for
audio is
cholesterol.
suddenly not clear.
Hello, can you hear me now?
Yeah, yeah, now it's clear. Yeah.
Yeah, you are already, Priyanka, you are already taking medication for the high cholesterol. But what I say, 140/90 is also a high blood pressure. So, what is most important, as I have said, कि you should start lifestyle modification. सबसे पहले है कि no salt diet or low salt diet. There is no कि salt बंद करना is not the solution. You should take less salt in the diet. That is half teaspoon of salt should be there in 24 hours meals, right? You should sleep properly, you should exercise, और उसके बाद you should daily monitor your blood pressure. In 7 to 10 days, if still your blood pressure is high, instead of having a dietary modifications and exercise in this, then definitely you should start with a low dose of medications. Okay, you should start with that.
Okay. So according to his suggestion, you should definitely start with some low dose medications because your
After, yeah,
BP
if
is
the
still high.
dietary advice didn't, yeah,
Yeah.
yes,
Okay. So you explained to us what is the normal blood pressure, that is 120 by
yes,
80 mm of mercury.
yes.
But what is the range? कौन से range के बाद हम ये बोलेंगे कि हाँ अब ये high blood pressure है या अब ये low blood pressure है?
Yes. Jaise, there are different stages of the blood pressure. If your blood pressure goes more than 130, systolic is the blood pressure जो हम लोग ऊपर का blood pressure, upper limit of the blood pressure we say. And if the lower limit of blood pressure is goes more than 85, then there is an indication that your blood pressure have started, and now you need to do the lifestyle modification or need to start the medications. Likewise, अगर blood pressure बढ़ते जाता है जैसे 140/90 or it goes to 180/100, 180/100 is alarming blood pressure. Means you are likely to develop complications in your body because of high blood pressures. So in such high blood pressure, you need to aggressively control your blood pressure because it can anytime can cause complications to your body, and anything can happen. So this is a very alarming blood pressure. We can have 180, 100, 160, 90 is very high blood pressure. You need to, at some times, you may need to get admitted also for the control of blood pressure.
Okay, so the earlier thing, I think हमने जब medical books में पढ़ा था, it was they used to say that 140 by 90 के ऊपर गया तो it's high blood pressure. So
Mhm.
has it changed? The guidelines have
Yeah,
changed,
yeah,
right?
it has changed. There is a term like pre-hypertension. Pre-hypertension मतलब 120/80 normal आपका blood pressure है. 80 systolic 120 to 129 and diastolic 80 to 85 is called as pre-hypertension. Means you are just entering the hypertension stage.
Oh,
130 to 139 and 85 to 89. Now it is called as stage 1 hypertension. मतलब आप stage 1 के hypertension में enter कर गए, right? उसके
oh,
बाद 90 to 95 and 140 to 149 is stage 2, and more than that it enters into stage 3. So these are the stages. So for that now the guideline says the 120 by 80, 120 by 80 is the normal blood pressure you should have, and you should target on that. Above that you are entering into the blood pressure, and likewise you have to monitor it, likewise, and start the medications and dietary modifications, lifestyle modification you should start.
right. और low blood pressure कब बोलेंगे?
लो ब्लड प्रेशर हम यूजुअली अगर ब्लड प्रेशर इट गोज टू लेस देन 110 और 100 सिस्टोलिक जो ऊपर का रहता है, एंड अगर नीचे का डायस्टोल इट गोज टू लेस देन 60, तो हम उसको लो ब्लड प्रेशर बोलते हैं. सो इट्स सच कंडीशंस में हमको ये देखना पड़ता है कि उनका ब्लड प्रेशर लो क्यों हो रहा है. कभी कभी कोई लेडीज में जो थिन बिल्ट है जिनका वजन कम है, तो नॉर्मली उनका ब्लड प्रेशर 110 बाय 70 रहता है, 110 बाय 70, विच इज नॉर्मल टू देम बिकॉज दे विल नॉट हैव सिम्टम्स. उनका वजन कम है, बॉडी स्ट्रक्चर लेस है, तो दे कैन हैव लो ब्लड प्रेशर. बट समटाइम्स लो ब्लड प्रेशर के कारण कॉजेज कैन बी लॉट. इट कैन बी बिकॉज ऑफ योर हार्ट इज वीक, और यू आर टेकिंग some medications, or other factors can cause low blood pressure. अगर आप उसमें अगर आपको सिम्टम्स है, इफ यू आर गेटिंग प्रॉब्लम्स एंड सिम्टम्स, देन डेफिनेटली यू शुड ट्रीट इट.
So we talked so much about symptomatology in high blood pressure groups, मतलब जिनको hypertension है. What are the symptoms that a person can get जिनको low blood pressure है या hypotension है?
या लो ब्लड प्रेशर हाइपोटेंशन में पेशेंट को चक्कर आना, दैट इज गिडीनेस, रीलिंग सेंसेशंस, they can have blackouts also. Usually these symptoms are there whenever they uh, are standing or sitting from the lying down position. Usually when you wake up in the morning and you try to stand, you will have the drilling sensation, giddiness, चक्कर आना, कभी कभी आंखों के सामने अंधेरा आना, और blackout. These are the symptoms of low blood pressure which you can this. Likewise the patient can have palpitation, दिल की धड़कन बढ़ जाना. You can have a sensation that yes, you can feel your beat, heartbeat you can feel, that is called as palpitation you can have. Likewise low blood pressure for long time can affect the circulation in your brain, and you can also be in a drowsy state, or you can go into coma also. That is a very severe complications of low blood pressure. Also it can affect the heart, causing heart attack also.
Oh, okay. So now that we have already discussed a lot of things, but I think uh, what the public would definitely want to know is that वो बार बार जाकर ओपीडी में जाकर या हॉस्पिटल में जाकर अपना ब्लड प्रेशर तो नहीं चेक कर सकते.
Yes.
So how do they monitor their blood pressure at home, and how do they
Hmm.
get to know कि हाँ मुझे हाइपर हो रहा है, हाइपो हो रहा है, रेगुलर मॉनिटरिंग करना,
Yes,
और उसके बाद मेडिकेशंस पे जाने के बाद भी रेगुलर मॉनिटरिंग घर पे कर पाना.
exactly.
How can they do
Yes.
that?
Yeah, usually first visit they have to visit the doctor, and they should check the blood pressure. Doctor will write a medication. उसके बाद they should learn how to take the blood pressure. आजकल there are many digital BP monitoring machines have came, that is very simple, and that is widely available in all the pharmacies. So they can purchase this BP apparatus, which is very cost effective also. They should monitor their blood pressure at least twice or thrice weekly. और द टाइम ऑफ मेजरिंग द ब्लड प्रेशर ये हमेशा कांस्टेंट रहना चाहिए. मतलब अगर आप सुबह 8 बजे आपका ब्लड प्रेशर देखते हैं, सेम इवनिंग को आप 8 बजे आपका ब्लड प्रेशर देखिए, और नेक्स्ट डे भी आप सेम टाइम पे देखिए. तो यू शुड डेवलप अ हैबिट ऑफ चेकिंग द ब्लड प्रेशर एट द सेम टाइम इन द मॉर्निंग, every day in a week. Yeah. And if it is coming constant, then you can check twice weekly or thrice weekly. So you know your blood pressures okay hai. Likewise, if you're not able to go to the OPD, you can contact your doctor on the phone, on social media, on WhatsApp. You can tell that your blood pressure is high, and then they may suggest you to start some add-on medication or to increase the dose of medication. But home monitoring of blood pressure is very ideal because every patient can't visit the doctor. Sometimes there are a lot of problems are there. So I feel BP apparatus, digital BP apparatus, they should buy every hypertensive patient and they should monitor their blood pressure at home.
So, are the digital apparatus that have come up are they reliable enough as compared to the sphygmomanometer?
Yeah, it's a very good question. They are reliable. Obviously, there are some percentage of error is there. That's why I advise to take the blood pressure reading. आप एक ही टाइम में 3 ब्लड प्रेशर रीडिंग्स लीजिए और उसका एवरेज निकालिए. Usually the 3 blood pressure readings should be taken at an interval of 1 minute. Like the ideal position is right arm supine position. आप चेयर पे बैठिए, आपका हाथ should be on the table. ठीक है, you should tightly wrap the band around your hand, and then you should take the blood pressure. You should relax position. You should not talk when you are taking the blood pressure. उसके बाद you take the second reading and then you take the third reading. You should take a average of 3 readings. इन 3 reading का average लीजिए and then you can take a you can get a idea कि आपका blood pressure कितना है and इससे error भी कम हो जाता है.
Yeah, yeah. So now we also talked about a lot of modifications. Okay, there is a question. Is hypotension or can it be a symptom of chronic fatigue syndrome?
Yeah, it can be. See, chronic fatigue syndrome is a very huge term, and most of the time, chronic fatigue syndrome ये term काफी लोगों में got syndrome after COVID. जिनको काफी fatigue symptoms हैं and they get this fatigue very easily, but it should not be mixed with hypotension. See, fatigue is a different thing. You get weakness, you get tired easily after coming from office, doing some work, but it can't be related to hypotension many of the times. Hypotension is different thing. Hypotension की वजह से आपको particular एक specific symptom रहेंगे चक्कर आना. Chronic fatigue syndrome, you will get weakness all over the body. You will get like you are not able to walk a single step. You are so tired in that, and that is every day or maximum days in a week or a month you will feel that. That is called as chronic fatigue syndrome. So you should be able to differentiate between the two. कि बाबा ये chronic fatigue syndrome है, it is not hypotension. That is more important. That's why BP checkup is important in that.
Yeah, and generally, chronic fatigue syndrome has now actually been included as a psychiatric disorder more than a
Yes, yes, yes.
medical
Yeah,
disorder.
yes, yes,
So it's basically it's more way more psychologically inclined, and the reason of getting chronic fatigue syndrome is now being said that you become symptomatic or you have somatic features because of the
yes,
psychological brain changes and the stress.
yes,
Okay. So we talked about some lifestyle modifications. So specifically, you also told about what all foodstuffs one can have. So we can just go over that once again because I don't know at that
yes,
point of time how many people were attending, but I think we can
yes.
just go over what to eat, how to eat, when to eat, and also
So
what to drink,
regarding
how to drink, when to drink.
yes, 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 yes. So there is a simple word for diet. I'll go with dash diet. DASH. Dash diet is dietary approach to stop hypertension. ठीक है? So on Google, if even if you put the word, you will get it. So what dash diet में क्या होता है? Dash diet is first thing is sodium restriction. नमक का restriction रखना, and the standard is having 2300 milligrams per day. You should, that equals to half to 1 teaspoon of salt per day. Okay. Second thing, you should eat vegetables, fresh vegetables, fresh fruit, and whole grains. And it should be like fat-free diet, low oily diet, It should include fish, beans, and protein diet. And it is very important to choose the diet which contains potassium, and it should be low in the saturated fat, जिसमें fat की मात्रा, चर्बी की मात्रा कम हो. That is more important. Then there are different servings. I will not go into details of that, but you should always include grains like a cereal, rice in your servings, vegetables, fruits. You can include poultry and fish products in your diet. Also, green leafy vegetables, nuts, seeds, and sugar should be very less, or there should be no sugar. So this is in short about the dash diet which I'm telling. And healthy eating, it's normally healthy eating that is more important.
And what all liquids can a person consume, like चाय कॉफी? क्योंकि ये बहुत कॉमन क्वेश्चन रहता है लोगों का कि चाय चलती है क्या, कॉफी चलती है क्या, कितनी मात्रा में चलती है, हम कितना कैफीन या थियोफाइलिन एक बार में ले सकते हैं, एंड आल्सो अदर जूसेस एक्सेट्रा.
Yeah. Regarding talking about tea, coffee, tea should have less of milk and less of salt, less of sugar in that. Likewise, आपको tea का जो रहता है, tea uh, will not have much of side effects on your body, but you should have less of tea per day. Likewise, coffee can cause high blood pressure also. So the coffee intake should be once or twice a day. अगर हम लोग avoid कर सकते हैं, we should avoid that, and we should have less of milk in that. Third thing, drinks. You should avoid cold drinks. You should avoid soft drinks because they contains a very high amount of sugars. Sugars will cause problems in your body and high blood pressure. You can have juices. You can have all fruit juices, but with no sugar. That is better. And it is always better to have raw food. Means raw fruits. It's always better to have than having it in the juice form. That is true. Like juices, you can have good fluid, good. You can have buttermilk also with less of salt. That is also good for the body and good to control the blood pressure also.
Okay, okay. Also, there is a question that pops up in a lot of people's minds कि यार मेरी तो लाइफस्टाइल अच्छी थी, मैंने कभी कुछ ज़्यादा अब्यूज़ नहीं किया, मेरा ट्राइग्लिसराइड्स लेवल भी नॉर्मल थे, मेरा एक्टिव लाइफस्टाइल है, मेरा सॉल्ट इनटेक कम है पहले से,
Yeah.
वगैरह वगैरह, बट कैन दे स्टिल हैव हाइपरटेंशन?
Yes, they can have hypertension. Just I this from your words, I remember the scene from one of the videos. There is some scene कि यार मैं कुछ भी नहीं करता था, still मुझे कैसे हो गया. तो जैसे ब्लड प्रेशर कोई भी बीमारी बोल के नहीं आती. There are other things which can cause. Even अगर आपको food, your food is good, you are a good athlete, exercise, so you can have problem. The cause can be
थोड़ा सा
genetic.
ऑडियो वापस से ये हुआ, ग्लिच हुआ.
Hello, yeah.
या
So
नाउ इट्स देयर.
even if you are following a good lifestyle, good food, good exercises, you can develop blood pressure. The common risk factors nowadays is stress, excessive work. You can have develop hypertension because of that. Likewise, if genetic factors are there, if your family uh, is having hypertension, blood pressure, so you can eventually have blood pressure. So that is the thing. You can't do it. You can't control it. So that is the thing. So anytime, any phase of life, you can develop the disease. So it's always better to have a regular checkup of your body routinely once a year at least.
All right. So, as we were discussing, some people might not have any symptoms
Yes.
and they may still be having hypertension. So, how do
Yes.
these people accidentally come across, to know कि हाँ मुझे hypertension हो सकता है शायद? इन लोगों को कैसे समझेगा?
इन लोग को कैसा है, गलती से वो चेकअप करने के लिए चले गए. Just many of times it happens कि I see people की उनके relatives को admit
Again, the
करने
audio
गए.
is
Yeah.
actually thrown.
Now you can, yeah. So many
Yes,
times
yes.
what happens कि उनके relative को checkup करने के लिए गए, and then they have shown to the doctor and they have just got a checkup and seen अरे my blood pressure is high. कभी कभी it is diagnosed during a very medical camps which is happening. kabhi kabhi there are apparatus at home and they just check the blood pressure, and sometimes it is diagnosed to be high. And sometimes what happens ki they land up into the complications like side effects like headache, giddiness, chakkar aana, reeling sensations, and then they have chest pain and they show to the doctor, and then they are diagnosed to have high blood pressure. So these are the common day-to-day things which happens, and many of the people are diagnosed with the blood pressure, and many of them, I'm telling you, neglect it also. They say, no, kuch nahi hota, I'll just control it. So this should not be the attitude. You should take proper advice and start the medications.
Because there are certain people, who might be having a blood pressure of 180, 200 systolic and a
Yeah.
diastolic of maybe 90, 100, 110, but they don't have symptoms, they don't feel anything much.
Yes,
And
yes.
उन्हें लगता
They
है कि
don't
बिना
feel
medications के control हो जाएगा. So what
exactly,
would your
exactly.
advice to these people be कि symptoms नहीं है तो फिर medications क्यों लेने हैं?
Yeah, same. I have a story, also many stories related that. One patient once came to my OPD. It was a start of my cardiology OPD, and he came with a blood pressure of 250 by 140. 250 by 140. Usually, the patient, many of times, people are not able to stand and they collapse. But he is walking and coming in my OPD. I checked his blood pressure and said, Baba, you are having very high blood pressure. Well, no, it's normal for me. My relative is also a doctor. He is not able to control my blood pressure, and I think it's normal for me. No, such blood pressures are not normal for anyone. Anytime, any stage of life, you can land up into complications. So whenever you are having high blood pressure more than, as we have said, the lines, border lines which have given the measurement, you should start with the medications. Definitely, even if you don't have any symptoms, you should start with, because if you avoid it, definitely at some stage of the life you will develop complications like kidney failure. You can land up into heart attack. You may have brain stroke, paralysis. So you have high blood pressure, you need to control it, you need to start medication, lifestyle modification. That is for true, even if you don't have any symptoms.
Correct, correct. And so, just as this one myth that we clarified, there are a lot of other myths revolving around
Yes.
hypertension. So, आप तो बहुत बार सुनते होंगे आपके पास कोई patient आ रहा है with some sort of a myth in their head. So,
Hmm.
what are those myths and what are the facts behind them? I mean, you could just give us some examples.
Yes. The most common myth is मुझे कुछ नहीं होगा, ब्लड प्रेशर मेरा अपने आप कंट्रोल हो जाएगा, so they avoid the medications for months, years. Second, they start the medications. मेरा ब्लड प्रेशर 2 दिन में कंट्रोल हो गया, चलो आई स्टॉप द मेडिकेशंस. दिस इज द myth. See, so stopping medication will not control the blood pressure. Again, it will rise. Once you are started with the medications, it will be for lifelong. The blood pressure medications are for lifelong. You can't neglect it. You can't avoid it. And a third myth that even if I'm having a high blood pressure, I will have nothing. Nothing will happen to me. So, and third, some things like some people, they go with some jadi booty type and other things, and they feel that if I consume that some home remedy, my blood pressure will control. I'll do this thing. I'll do some vigorous exercises and meditations and yoga. Many of times the blood pressure don't get controlled by doing all the things. It
That
is.
comes to another leading question. Are
Yes,
there actually any home remedies for hypertension, or there aren't? And if so, why?
there are as such home remedies is like only having good food and restrictions in your daily habit.
But
That is
not
only the home.
Ayurveda or Jadi Buti or things like that,
No, no,
right?
no, 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 no. I
Yeah.
don't believe in that.
So,
I don't believe in that. But you can take Ayurvedic and Jadi Booty, but you should also take allopathic medications. What I feel, if you're for satisfaction, you can take that medication, but you should continue your allopathic medications. What I feel.
yeah, but people generally tend to, अगर वो एलोपैथी भी ले रहे हैं, होम्योपैथी भी ले रहे हैं या आयुर्वेद ले रहे हैं, सब कुछ अगर ले रहे हैं, तो उसमें
Ah,
they tend to give more importance to आयुर्वेदिक जड़ी बूटियाँ,
yes,
and then they
yes,
think कि हम ठीक हुए हैं तो उसके वजह से हुए हैं और एलोपैथी की
yes.
वजह से नहीं. That
Yes,
is another huge myth that they have,
yes.
which needed to be busted. Yeah.
Hmm.
And you were talking about meditation and yoga. Sorry, please go on. Does that help?
Yeah, initial phase of blood pressure, it can help.
The audio
Uh,
is again.
yeah, initial phase of blood pressure, the exercise, meditations, and yoga can help if you are having low uh, borderline blood pressure. But agar if it keep rising, अगर बढ़ते जाते then you need to start medication.
Yes. Okay. I think we have almost covered a lot of things. If there are any questions from the audiences, they may be flashed now. But till that time, do you have any a very very important take home message related to blood pressure for the audience?
Yeah,
Anything else?
my yeah, but the message would be like, uh, don't get afraid if you are getting blood pressure. It's a very common thing. You should not be afraid, but most important, you should never neglect it. And you should be very much open to tell your doctor about blood pressure. And you should always accept it. I'm having blood pressure, and you should take medication and continue with this. And you can have a very normal life. People are taking medications and they are doing a lot of exercising. They are doing a lot of sports also. So you need not to worry. It's a very common disease in the Indian population. So you need not to worry about having blood pressure.
Correct, correct. So, thank you so much, Dr. Bhagwatkar, for coming onto our show and talking about blood pressure and clarifying a lot of myths revolving around it. And what exactly was your advice for the audience? I really hope that they will listen to you and they would definitely go and show their physician. Okay, so there is a question. How does cholesterol affect blood pressure? What's LDL? How to reduce LDL? मेरा भी
Cholesterol,
borderline raised LDL. I would also like to
yes,
know.
yes, yes. So cholesterol, it affects the blood pressure. Cholesterol gets deposited in your walls of the arteries. जो हमारी नसें हैं वहाँ पे डिपॉजिट होता है. उसके कारण the walls become thickened. उसकी इलास्टिसिटी कम हो जाती है. Elasticity कम हो जाती है. Just imagine that you are if you are gardening, you are using pipes. तो अगर पाइप में गंदगी जमा जमा हो जाती है and it get old, तो it loses elasticity. जब elasticity हमारी vessels की कम हो जाती है, तो automatically blood pressure rises. What is LDL? LDL is low density lipoproteins. It is, in short, it is the bad cholesterol. Nowadays, the guidelines, American guidelines says, which Indian medicines we practice the American guidelines. It says that you should keep your LDL below 100. Your LDL level should be below 100. If it's more than 100, you should start modification, lifestyle modification, dietary proper. And if still it is very high, it's not getting controlled, you should start taking medication to control your cholesterol. So LDL is a bad cholesterol, which get deposited and cause blockages and heart attack.
So, yes, so I think that was clarified. So, as I was coming to wrap up the show, I think I should continue with that. And so, thank you so much for accepting our invitation and
Yeah, thank you.
coming on to this platform and speaking for the public awareness related to blood pressures, high as well as low. And please listen to your doctor's advice and continue your medications once started. और अगर आपको सिम्टम्स ना भी हो तो प्लीज़ जाकर एटलीस्ट एक रेगुलर हेल्थ चेकअप कराते रहिए, जिससे आपको एक्चुअली समझे कि आपको हो क्या रहा है. और अगर सिम्टम्स आ गए तो फिर तो डेफिनेटली जाना ही है. Okay, so Evrox Healthcare is a digital healthcare company, as I told you earlier, and its flagship product is the F1 app, which is being launched, and the demos are being given to all the healthcare workers, doctors, nutritionists, mental healthcare workers, etc. Whosoever wants to join, they can actually ping us on the WhatsApp number that is flashing on the poster, and that will be again flashing on the poster. Kindly contact us for your demo, and you can actually join the F1 app and get your consultations online. And at Evrox Healthcare, we obviously care about a lot of such public awareness issues and which are related to medicine as well as psychology. So you can always suggest us as to what you would want as the next session to be. And also always like, subscribe, and comment whenever possible, and continue showing us this support. Thank you and have a good night.
Thank you.